But anyway, thanks for everybody for joining us today. Looks like we're a little smaller group so far. So it's been right at a month since we last met. I think everybody has been watching numbers. We continue to see trends down with community positivity, or at least stabilize. Actually, it went down and now it's kind of stabilized, so that's good. So our hospitalizations in total have been trending down. This week would appear to start to be an exception to that as we're actually trending back up. But we'll see again how that goes. We have seen a lot of progress, I think, from a vaccination standpoint, and that's kind of now continuing, and that's both local and across our state. The number of people being vaccinated each day now in the state has gone up significantly over the last two and a half weeks. So that's also very encouraging. We have a new health order, so we'll talk about that a little bit today and how that, a lot of the restrictions have been eliminated for a lot of businesses. We do continue to see new guidance fairly rapidly, once or twice a week now from both the CDC and from KDHE. And so there's one part of this is we're still in the learning process, but also trying to help people understand how to reduce restrictions and do that in a common sense way. We're now, we're into March, so in 9 months from the first people getting their vaccines in the clinical trials. And at this point, I think we've seen good data about how folks are maintaining their antibody levels. So we know that that's good for at least 9 months, and we're anticipating that that's what we'd be thinking about. So Dennis, do you want to start us with our roll call?
Sure, be glad to. Good afternoon, everyone. You want to undo your microphone so you can do your cheery acknowledgement that you're here today. I know a couple of people were not able to join us, so I'll run through Carla Hagemeister, Lisa Sisley, Alice Massimi. There she is. And then Robin Cole.
Yes, I'm here.
Great. Linda Cook.
I'm here.
Dennis Butler.
Here.
Representative Mike Dodson. Dennis Cook, did I get you already?
Nope, you did not, but I am here.
Great. Gina Scroggs.
I am here.
Mickey Dean. Sarah Holly.
I'm here. Hi from Wamigo.
Great. Kelly Loud. And Cheryl Grice.
Here.
Sheila Hager.
I'm here.
Great. Fanny Fang. Karen Hibbard. She's doing 2A. Lottie Baker. Commissioner John Ford.
Present.
Commissioner Dean McKee. Commissioner Keith Asher. Julie Govert Walter. Kelly No. Lieutenant Colonel Kelly No. Steve Elstrom.
Present.
Great. Vern Hendricks. And then we've got Marissa on here from the Regional Partnership. All right, we've got everyone. Thank you. Turn it back over.
Thanks, Dennis. So on February 24th, about 3 weeks ago, the Riley County Health Directorate had issued Health Order number 20. And so that did removed the restrictions around business hours, seating capacity for a subsequent date after that. The order does maintain at this point the masking requirements kind of to complement the cities through April 1st. And I think there's, again, ongoing conversation. I would assume we'll have some conversation about that today as well with this group. As I mentioned, a lot of ramping up with vaccinations. We've seen a widening over the last couple of weeks of who's kind of officially considered in group 2, that's what's caused the widening and the time that's now still being spent to get people vaccinated in phase 2. But that, again, I think we're continuing to get hundreds of people done now at each one of the county sessions. And so it just keeps working through the population. I think that's a very good positive thing. We had received actually a note this week from KDHE. They're anticipating another bump in vaccine volume coming to the state. And so they're starting to plan for that and how that would be distributed, because you want to phase up the ability to deliver the volume as we see an increase in the actual quantity available. So trying to do some pre-planning for that across the state as well. Certainly, task force with the health department have been working on a lot of things related to this ramp up and getting everybody through. And John, do you know, are we now at like 14 or 15%? Or are we higher than that as of this week?
We'll be higher than that this week, but I think at the beginning of the week that sounded about right.
Yeah.
Keep in mind we have 4 clinics this week, so that number should continue to rise.
So that's one thing. I mean, I think, again, help people keep perspective when they do one of these large clinics with 600 to 800 people in that day, that basically is a % of the population. And so that's how you keep making these kind of strides. If you have 2 or 3 of those a week, you're moving up 2 or 3% a week. Certainly good progress. We do have Alice with us today, one of our newest members of our task force from Riley County Health Department. She's their public information officer. So Alice, didn't know if you could maybe talk through current things around the health order, vaccination plan rolling forward, kind of other things that we might see changing or testing, kind of what might be changing with that too as we end out of March.
Of course, let me get the microphone down here. And also, I'm on the EOC command staff, so if people have any questions regarding EOC, feel free to direct those towards me. I understand at the last meeting there was some concern and questions raised regarding EOC and its makeup, so I can address those, and I think Scott French from the fire department is also joining us, and he can address those also if people have any questions. So we have vaccinated, as of right now, we have a nice little dashboard on our website that is in real time, updates real time. We have fully vaccinated 4,951 people. 6,514 people have received one of 2 vaccines, and those are these are individuals that have been vaccinated by Riley County Health Department or our partners at Stone Creek, Lafine, Duns, and Berries, because we have given them some of our allotment of vaccines that we're getting from KDHE. We do not have data on how many people Dillon's has vaccinated, but I do know that I think there's 2 or 3 Dillon's locations that are actively vaccinating individuals in the area, so that number is probably higher. And then I also understand that, Bob, you guys have had some pop-up vaccine clinics too, and so I'm not sure how many people you vaccinated there, so there's probably some additional numbers that we're missing out on there. We estimate that there's about 62,000 people in Riley County that are eligible to be vaccinated, so those are people that are over 18. Since we've been getting the Moderna vaccine, that's only for individuals 18 and over. So if we get Pfizer, then we could possibly vaccinate those who are 16 and 17. But right now we're concentrating on those 18 and over. So I'm not good at math, so I don't know. I think that's about 11,500 people that have received at least the first dose by the health department. I don't know what percentage of the population that is, but as John said, this week we had 2 days that we had clinics for first doses, and then today and tomorrow are for those boosters, those second doses. And next week we'll also be having clinics for the first doses and those booster doses again, and just kind of keeping on that path every week, just holding as many clinics as we can, dependent on the allotment of vaccines that we get from KDHE. The big thing to mention is that while our vaccine clinics are doing great, out of the people that have registered with Riley County, we only have 8,463 names left on that list, which is not a lot. So there's a lot of people that still have not registered in Riley County. So kind of our next push, especially from PIO perspective, is going to be to try to get that word out there and encourage people to register and get vaccinated, because we really need 50 to 60% minimum of the population to get vaccinated. And then if you talk about herd immunity, I know Bob can probably talk about that. You need like 90% of the population. So it seems like why there's been this big rush out of the gate to get vaccinated, it's really kind of slowed down on the number of people requesting to get vaccines. So that's something that we're going to be looking at. Also, as Bob noted, our phase 2 by mandate of KDHE has expanded to include high contact critical workers, which is a massive group of individuals, massive. So we are working to get through that phase 2 right now before we can move on to phase 3. And are getting emails and calls from people who are pretty concerned who have severe health conditions and are under the age of 65 and have been bumped down now to phase 3, and they want to know why they can't get vaccinated. So we've had to direct them to KDHE. In regards to testing, Well Health, their contract has been extended to May 21st. They are now out at the ACS location, just so then that way we didn't. Number one, it is an all-weather facility, so in the rain they can still do testing, so we don't have them outside or have to worry about any issues at SECO. We also have the RADX UP team that is a mobile unit that is going out roughly 2 times a week throughout parts of the county, underserved areas of the county, and they are doing the saliva testing of individuals out there. As Bob said, the numbers are low, but they're still there. There's still cases. We have 60 active cases right now. We had 12 new cases this week. So, we're still encouraging people, even though the restrictions are lifted, to still social distance, to still kind of keep gathering small and to wear their mask. So that's, I think that's the big gist of, and then the other big thing too is KDHE came out yesterday saying that the immunity, if you're vaccinated, is 6 months. So previous to that, and I think CDC for a while was saying 3 months, and we were kind of worried we were going to have to start the process of vaccinating everybody over again as soon as we're done. But they've moved it up to 6 months, so that's encouraging news for us. And I think that's about what I have, and I'm happy to answer any other questions that y'all have about EOC and the vaccine clinics and testing.
Say, Alice, would you maybe just briefly talk about what you guys have done for the homebound population? Mm-hmm. And also
Sure.
for the homeless population, because we've tried to address that too.
Both, we've done both. So the homeless population, we partnered with Common Table, and we brought the mobile, we provided vaccines, I think it was last Tuesday, at Common Table to the homeless population. We had about 20 people get vaccinated. The goal is to try to do that again and possibly partner with Be Able and provide the vaccines at Be Able, and possibly use the Johnson & Johnson vaccines that we've received, just because that population, it's hard to schedule to get them that second dose. And then we are also continuing to vaccinate those who are homebound. And so we've had several hundred requests for individuals who are homebound throughout the county. And it's a tedious process though, because we have to send out a nurse, we have to send out somebody from EMS, and drive to these houses, and then after we vaccinate them, sit there with them for 15 minutes to make sure they don't have any reactions. But they're getting through that list, and our plan right now is the Johnson & Johnson vaccines that we've received is to utilize those on the homebound, because in that way we're just going out there once, we're vaccinating them, and we don't have to worry about driving back out there and having the team out of the clinic.
Thanks, Alice. The other thing you'd ask about through the hospital, so we vaccinated about 850 people, both first and second dose. I think we've got 12 folks getting their second dose in another week or so, because we had some Pfizer. Okay. And then we'll actually be back down to 0 vaccine available.
And is that just employees, Bob, or is that all?
It's medical staff, associates, and then not quite 200 patients. These are all high risk cardiac patients, diabetes patients. That's who we try to target first.
Okay.
We're some of our high risk folks.
Were those the ones that were vaccinated at the Catholic Church?
Yeah, we borrowed the parish hall.
Okay.
At St. Thomas More, because we actually don't have a site here at the hospital where you can really kind of spread out to do 150, 200 doses in a 2-hour period. So
So those
We
were
used
critical. You said those are people that had severe health risks, Bob?
Yes, we actually used our current patient log
Okay.
and reached out to patients is how we collected those folks to get vaccinated that day.
Great. And those are
Or
all
they actually
Riley County? Oh, sorry.
So I'm sure some of them are not from Riley County because when we're talking about patients, we don't care where people live.
Right.
If you're if you're a current cardiac rehab program person, then they were asked if they're interested.
Okay. Well, that helps us. Thank you.
Nope, it's like everything else. Everybody we can get vaccinated is a step in the right direction. So.
And then for Alice, am I correct that basically all the teachers in 383 have been vaccinated if they wanted? Is that correct?
Yeah, we've offered teachers the opportunity to be vaccinated. In fact, I believe tomorrow, a bunch of them are getting their boosters, so they'll be fully vaccinated. And that's just not USD 383, but also the other surrounding schools. And then tonight, we're going to be open from 5 to 7 to vaccinate childcare workers. And we're keeping the later hours because, of course, many of them are caring for children during the day. So we have those extended hours tonight to kind of help them out. And then also a lot of the congregate settings, people that work in the homeless shelter, other places like that, we've been able to vaccinate them.
Did anybody have other questions for Alice? Okay, well, thank you. So Scott, we're gonna kind of ask you to maybe just give some updates about the planning process, and then also just how things are kind of coordinated, work with the EOC, and how this ties into everybody from FEMA back down here to local agencies, just to give, I think, some background, some just perspective of how everything kind of works.
Post 9/11, an executive order was issued to get everybody on the same page. So what was established was a national incident management system. And part of that was the National Response Framework. And that's how we developed the ICS, the term EOC, those chain of command, getting to a single point of decision making is how we operate here in Riley County. So over the last at least 10 years, every emergency that we've had in Riley County, or emergency declaration or disaster, we've operated under the incident management system. We utilize the unified command system. So a lot of people, we talk about the EOC. Well, it's actually the incident command system that we're talking about. And that's typically made up of all of our emergency services. So there's a representative from the Manhattan Fire Department. There's a representative from Riley County Emergency Management. There's a representative from Riley County EMS and a representative from Riley County Police Department. All four of those agencies typically are involved in any multi-jurisdictional, multi-agency response. And as the pandemic falls in line with the national framework, ESF 8, which is an emergency service function, which is the health department, is the lead agency on all pandemics. So we brought them into the unified command, and as such, they become the incident commander for the overall incident. The unified command provides the support, having a little bit more experience in dealing with disasters and making these decisions and the contacts. We provide the incident command, in this case, Julie Gibbs, the support and framework for her to work out of. The incident command system involves both the command staff, which is the unified command, which also Alice here, our PIO, is part of the command staff. Liaison, if we have multiple outside entities involved, so the task force here, or Fort Riley, or Kansas State University, or Gary County, all those have different people involved. We have a liaison officer that is designed to interact with them when necessary. It's a very scalable system. If we don't have specific roles filled, all that responsibility falls on the incident commander. In this case would be Julie Gibbs, our health director. And I think you see some of the benefits of having the system that we're utilizing over some of the other counties and states where you're tasking one department that's not designed to be able to manage this overall a year-long incident And so we're able to provide our support. The Emergency Operations Center is technically is more of a building, a location. That's where all this stuff typically happens at. We have support functions. Public Works would be considered part of the Emergency Operations Center. Bob Koppel with the hospital is part of the overall incident operations, the EOC. Now, we don't utilize them in every decision making, but we're constantly going out and looking for data and information to provide to Julie Gibbs for her to make a decision. And the checks and balances in this system, which is different than a lot, is our Board of Health. So every decision that Julie makes as the incident commander has the opportunity to be evaluated and reviewed by the Board of Health. And that's how every order comes out. That's how every decision typically is made outside of typical day-to-day operations. But the Board of Health is overseeing any policy changes, no different than our elected officials. We have, obviously our city commission, City of Manhattan has a commission that would develop policies, and the mask mandate ordinance as a policy decision that was made by the city commission. That's where the public has the ability to go and review if they don't agree with something that the incident commander has made as a decision. You go to your elected officials. Those are the people that are responsible for the public. In the end, that's where that check and balance, I guess, if you will. The EOC is more of an insulated body to be able to make decisions from a single point and evaluate more of an isolated stance, because we know there are so many different opinions and thoughts and ideas, and we're just trying to gather all that information, provide all that data to Julie, and help her make the best decision for the community. And that's how this one is operated. It is very different, very unique, because of the length of time, the different, everybody and everyone that's been affected. It's been difficult, there's no doubt, but I think the system that we have in place has worked well, and looking around the rest of the state, we've done a fairly good job at it. There's going to be a lot of lessons learned. We'll have an after action. We'll redevelop, and the health department has a pandemic plan. There's a lot of lessons that we've found out and holes that will be hopefully fixed, and the next one moving forward, we'll have a better plan. But that's kind of a gist of how we're operating, who's involved in it. I don't know if there's any specific questions or anything maybe I said that isn't clear.
All right. Thank you, Chief French. Appreciate you being here today and providing some information on that. I know there have been questions about it, and I think it's always good when there's information vacuums. There tends to be misinformation, and so I'm glad you were able to come in and clarify that situation. Go ahead.
I was just going to say, I do appreciate this group. I think, I know we don't necessarily always have somebody on it, but I assure you that members of the EOC, members of the governing bodies are paying attention to what you have to say. We're paying attention to what the medical task force has to say, as well as the K-State. We meet with K-State, and I think, Jason, you're on it with K-State, and John Ford, I believe, is on that committee. Usha Reddy's on that. And we meet Mondays and discuss how everybody's doing. We meet every other week with other counties to find out what they're doing, Fort Riley, and that's how we're making the decisions here locally.
Awesome. Commissioner Ford, do you have any, I know you're on the Health Commission, any other things you might want to add to that? Or
in terms of just the Board of Health, each one of us kind of, I think, works with that differently. I think Scott will probably tell you I'm probably maybe a little bit more hands-on. I like to talk to each one of the members, sometimes separately or sometimes collectively. I've been on several different Zooms, both with the entire group and then, individually when certain items or certain issues come up, just to get as much overall and just high view clarity. And so it makes that decision-making process a little bit easier. I think probably from our perspective in terms of Board of Health, there's also a lot of different state regulations and statutes, and particularly with this pandemic over the last year that have changed on the fly and have made our job in this process a little bit more challenging and difficult, and trying to work, with the EOC and the other entities locally. But I think we've managed well, and I think it's because of a lot of the reasons Scott said, and just the actual foundational approach that we've had. And there's lists and lists of plans, and we have tabletop exercises, even, and we'll probably do that post-pandemic too, to just kind of make sure that we're all brushed up and everybody knows where they fit in, the order of any emergency, whether it's health related or not. So that's kind of where we fit into that process. I kind of had to learn a lot of that on the fly too, and I still keep learning that. Just FYI. So that's about all I can add, really.
Okay. Any questions for Chief French? Okay. Well, thank you again for being with us, and we appreciate the update and the information. At our last meeting, we received the results of the Regional Business Confidence Survey. Today, the Regional Council staff is with us to give us the latest update on the survey and an update on the initiative to create a regional dashboard. So, Marissa, are you going to do this? Is that correct?
Yes, I will. So thank you, Jason. So as Jason said, we have been discussing the business confidence survey that started with you all, and we were able to implement early January. We closed the survey in February, and then have been looking at the results last month. So we finally kind of got all of that together up on our website. And so if you go to our webpage, so flinthillsregion.org, go down to view the initial results, it'll take you over to a dashboard page, and also something that has a summary report. And so with that, there's just kind of a summary of our key initial findings. And then from here, we pulled out some pertinent questions that were in the survey. Some of the questions weren't really super pertinent to various parties. We tried to pull the ones that were the most important, and you can actually filter by county. And if you want to, you can filter by municipality if there were respondents in that municipality. So you can kind of go through and see overall, for instance, COVID's had a negative impact on our businesses. That's kind of a given. And so you can kind of go through and look at what that is, but you can kind of dig a little bit deeper into, okay, what were the biggest concerns that our businesses had, and so forth. We did summarize this in a PDF as well. There's a little bit more detail on the PDF. And so when you go into it, you can click through. It has this little page flipping sound, so I apologize for that. But you can go through, see, okay, as a region, what were the biggest concerns? And so I do personally have to say that after doing this survey and everyone explaining that their biggest concern was that they needed faster access to the vaccines, adding those workers into phase 2, I think is phenomenal. And I think our businesses are definitely going to be better for it, and our region will be as well. So that's just a quick summary on this. That's where to find it. We'll be pushing this out to our businesses, hopefully tomorrow or Monday, since the president did sign the American Rescue Plan Act this afternoon. We're going to include some documents in the messaging with that as well. But with that, that's all I have. So if any of you have questions, please feel free to let me know. But aside from that, I'll give that back over to Jason.
Hey, Marissa, it's Dennis. Two things I haven't seen has the Mercury or any media outlets contacted you about the results of the confidence survey?
Not so much. I think K-Man might have picked it up. I know that there was a small blurb on it, but nothing really, because we haven't pushed it out too much. I'm thinking when we push out this initial to the survey respondents who wanted to be contacted, we'll definitely try and get that pushed out some more.
Great. And then didn't you say at one point that you found out from the survey respondents that there was some discussion about how the businesses would adapt based upon the changing orders, or how the orders are lifted, and kind of how they approach their customers on this. Is there some information on that?
Yes, so that one, we had a hard time incorporating some of those write-in comments into our summary results. So we're still kind of working on this. This is going to be a very fluid document that we keep updating. But what Dennis was talking about was we had a couple businesses who were concerned if their neighboring municipalities had different health orders than they did. Essentially, you cross the road, and if a business across the street doesn't have to do one thing but you do, then you might end up losing clientele. So we don't necessarily have the data to support that, but obviously that's something that our business owners are concerned with. Logic might kind of play in there as well, of if people are kind of anti-mask or whatever other sort of measures are in place, that people might say, hey, I want to go to the place across the street. On the flip side, people might say, hey, I want to go to the business that still has these measures in place. So that is definitely something to take into consideration, that our businesses are a little bit worried about, okay, as municipalities start adjusting their measures, what impact that might have on them if other municipalities do away with them completely, or they have more strict, or vice versa. So there's definitely kind of perception issues within the business community, but then also things that they're just witnessing firsthand on their own, of if their neighbor's not doing it and there isn't any enforcement, but they feel like they need to, then they're losing business.
Okay, any other questions or comments for Marissa? Marissa, thank you for being with us and for doing that work. That was great. And we'll look forward to receiving that. So as Marissa mentioned, we're expecting today, if it hadn't happened already, that the president signed the latest congressional action to help address the economic impacts of COVID and stimulate the economy. So Dennis has a document up. He and I did our best to try to track down the provisions, all the provisions, because some resources had some and didn't have them all. So we're going to do our best to get through them here. So at least initially, unemployment benefits extend the existing 300 extra weekly unemployment through September 6th, and a tax break on the benefit. So very helpful for those who may be unemployed. The big publicity is around the stimulus checks, $1,400, so roughly $400 billion of the total package, 20%, and for individuals earning up to $75,000 and couples earning $150,000, as well as the expansion of the child credit, and both in terms of the amounts and the age. So quite a bit for middle class taxpayers in this as well. The aid to state and local governments has been a controversial topic for a variety of reasons. Obviously, Dennis has been smiling all day, so I assume that he's pleased with that. And I don't know, Dennis, if you want to comment on that at all. I know you've done a little bit of research in terms of how that might be.
I was feeling good until I saw Los Angeles is slated to get $1.75 billion just for the city of Los Angeles. But no, this is important for us because from all the stimulus packages of the past that has been passed by Congress, they have never acknowledged that local governments have lost revenue from decline in business, mainly sales tax, but other different revenue sources. When we canceled Parks and Rec programs, we didn't have those revenues in there as well. And so there's never been a recognition of that. And so this bill does provide some recognition that there has been some revenue loss, that local governments have laid off furloughed staff. And so we do not know the exact formula or exactly how this pot of money will be distributed or how governments will be eligible. We have a little bit of sense it may follow some of our HUD, CDBG funding mechanisms. That seems to be the way some are going. And like I said, other governments are figuring out roughly how much they may receive. So we don't know what that means for the city of Manhattan. And then again, there's also part of a infrastructure component, a minor infrastructure component to that. And so trying to figure out what that means in terms of if it's an allocation, project specific, what it may be. But for everyone here to know, I mean, from a local government perspective, we have had budget tightening, revenue loss, adjustments and things that we've had to do for local government. And fortunately, we've been able, just like the county and others, to get through that with different measures. So it's just nice to have a little bit of relief that will help us address the expenses that we've already taken on that were reimbursed, new technology, remote work, PPE, a lot of those things we've already been able to address. But then just really having this recognition that there has been a downturn in revenue to local governments, just like businesses.
Yeah.
That's it.
Yeah, think about some things you don't think about, but think about the TGT tax and how much that revenue has been down year over year. And of course, that impacted the CVB, but it also impacted, I think, some of the other business organizations and some of the facilities that have been built with that money that was pledged. John, do you have any updates on how you foresee some of that funding going?
Yeah, I've been on several national teleconference calls. I know that the United States Treasury has kind of the mechanism on kind of establishing everything. $65.1 billion of that specifically is for county, parish, and boroughs. All 3,300 and some change of those around the country. I don't know how specifically it's divided the rest of the way through for the other entities there, but I think they're going to follow somewhat of that same formula too, both for cities and counties. If you have a certain population and over, you get the one direct payment based off of a formula, and then the rest of us, I think, is based off of that. Is it FEMA? It's a FEMA formula. So that'll be interesting to see. As far as I know, it's coming directly to the entities. So if it's municipal, it's going municipal. If it's county, it's going county. If it's state, it's specific to state. Dennis mentioned the infrastructural part of that. That also includes broadband and wireless in that infrastructural component for each entity. And then there's money set aside as well for community health, public health, and mental health related infrastructure and services too. I don't know what the breakdowns on all those are, but at least for, on our side, particularly for the public health side, that's going to be a big benefit, both trying to move through things currently and then, for the future. So that's kind of what I know at this particular point in time. I'll be interested to see what the breakdowns are, the time frame. We discussed it briefly this morning. We're going to try to follow probably our own foundation that we kind of used in the summer and the fall, and we're hopeful that the deadlines for all this stuff kind of spread out a little bit, so it's just not such a quick turnaround. Panic. But and there is also, I might mention, and Jason, this might interest you too, there is a separate allocation that will be for small business and nonprofits as well. So we may follow some of the same kind of foundational approaches we took last year, because one, it seems to work, and two, it allow us to work together to see where, here locally, where overlap won't be, and we can stretch it out and get it out to as many different entities to help moving forward. So I've got another call this afternoon as well, so maybe some of those dynamics will come up and I can pass that information along. And that's really about all I've got.
Awesome. Thank you, Commissioner. A couple of things that also, and we're still trying to track down the specifics that aren't on this list per se, but there was more money put into the PPP program that's been very successful in keeping a lot of our smaller businesses open. And then there was special money set aside for restaurants. So I know Kelly said she was having trouble hearing earlier, but our understanding is there's going to be a pretty sizable amount for restaurants, as well as performing venues. And so we'll be watching that. And then some other money in the SBA to help with some targeted businesses, particularly in distressed areas. And so we're going to monitor and see how that all works out, and try to get our businesses here as much aid as they can get to hopefully stay open. On some of the other items, there were tens of billions that was set aside for coronavirus testing, contract tracing, and then of course the distribution supply chain of the vaccine. Set aside 20 billion in emergency rental assistance and other relief for homelessness, and 10 billion for mortgage and home ownership assistance. There's quite a bit for school support. I think our schools have been done a great job of getting open and educating our kids. Some areas have not been as successful as we have, and so there's some funds set aside to help schools continue to either open or remain open. Colleges and higher ed institutions will receive 40 billion. So hopefully Linda is already working on ways to get that for K-State, as well as any available potentially for MATC. And then childcare grants to help people, Head Start, early childhood education, health and nutrition. I think we all recognize the importance of that to get people back to work. 86 billion for failing pensions, and then some other provisions, 510 for FEMA Emergency Food and Shelter Program to support homeless services. The employee retention tax credit, which has become a really strong tool for people to keep employees during some challenging times. Increase the value of the federal COBRA health insurance program from 85% to 100. Infrastructure, which Dennis talked about. Provide corona-related student loan relief tax-free, and Amtrak relief funding, as well as some other education funding as well, and rural healthcare provider funding. So quite a smorgasbord of money there for a wide variety of service providers, local service providers that will have opportunities to access some of that funding. And I don't know if anybody's seen if it was officially signed today, but we expect it.
He signed it today at about 1:03.
Okay, so I think a lot of the people on this call are going to start working on that. So any other comments or things we might have missed? Because as I mentioned, Dennis and I missed a few as we were putting that list together. So,
and they did say that potentially the $400 stimulus could be flowing this weekend. So
$1,400.
The individual stimulus checks to families, some of those could be rolling out this weekend. Since he signed it today, we'll see if that holds true. And then it kind of depends on when you filed your taxes. But anyhow, that was encouraging news that they're ready to move fast, hopefully. Hopefully they'll move as fast to the other segments as well.
Jason, this is Kara. I wanted to ask you, and maybe you said it in the beginning and I missed it. Will you be able to email that summary out to us? Because that was a really good summary.
Yes, I will send it out after the meeting today.
Thank you, Dennis.
Keep in mind,
I don't have the PPE. I'll send the link to the PPE though.
We'll look for that and try to get that added onto it. So, all right. Any comments, questions, additions? All right. Well, I'm going to hand it back off to Bob.
Thanks, Jason. Yeah, I think we probably can all be pretty confident the next 24 hours will be a lot more detail come out about some of these specific programs or assistance. So we want to just take some time today to kind of do a little catch up, if you will, or just kind of check in with people, and a couple introductory questions. One, what sorts of feedback, what sorts of observations have people had over the last couple of weeks as we've seen the relaxed health orders? Any sort of, what's been kind of your response to that? I think it's helpful for our elected officials to kind of hear that too.
I'll chime in to start with if you want, Bob. It's been pretty much mixed for me. We get some that are still concerned because we're maybe not as far along in the vaccination process. And then there's some that are clearly very, very happy. I've taken the last couple of weekends in particular to kind of drive around, see what the energy's like. And it feels like it's high volume. Some of that's probably the weather too, being as nice as it's been the last couple of weeks, as well as getting people out. But overall, much like it has been over the last year, the response to that's been pretty mixed.
I can add to that if you'd like me to. So concur with John that it has been fairly mixed. Really super grateful that the city was able to provide us with outdoor dining platforms, because if anybody was downtown on the weekend, you would have noticed that those platforms were absolutely packed, which was such a great thing. I can say pretty much certainty that our restaurants in downtown have just maintained their same level of operations. The plexiglass is still up. Everybody's wearing masks, and it's nothing has really changed very much. Probably we'll see that loosening as more food service workers become vaccinated and more of the public becomes vaccinated. But I think it is a key for us anyways. I can't speak for anywhere else in the city. For us, I think we've made it pretty clear to our elected officials that the vaccinations need to continue to roll with a pretty good rate, and make sure that we're able to protect our employees and also our patrons.
So Dennis, go ahead.
Yeah, I would just say, as far as Aggieville is concerned, it's a welcome relief. Everybody's been pretty excited about the restrictions being loosened up. But as far as has there been a big jump in business? Actually, we've got a lot of businesses who now have got to go through the hiring process, and they don't have enough employees to be like they used to be. So, it's not it's not like we were out of the pool, now everybody's in the pool. It's going to be it's a welcome relief, and and hopefully everything is just getting better and better all the time. And we really do appreciate all the effort everybody's done on that. But it's not just like turning the switch on. Everybody has to kind of ramp up for this. And so right now, I would say it's great, but it's still cautious. But we do appreciate it.
I would just add for K-State, we're maintaining all of the restrictions at K-State that we've had for the, wearing mask mandates on campus, the social distancing in the classroom. So we're still maintaining the schedule for the rest of this semester that we have with the hybrid of some in the classrooms, probably most on the online version of the class, just to get us through the point where we get more people vaccinated, build up more of that herd immunity, because there are concerns about those variants. So our hope is that by getting us through this semester, kind of watching what things happen, the plan is to really open things up then in the fall semester, going back to our normal in classroom, go back to the football games like they normally were, or sports and other events, even looking towards how we would open up McCain. But it's for now, it's just being very cautious until we get more people vaccinated. And we're also watching, we're looking at today what's going on around the world, and what you see with that, is it the Brazilian or the South American, the virus? I mean, that country's red on the charts. If you start to look in South America, things are pretty hot down there with that variant. So it's those things we just want to make sure they don't drift to the United States and create any sort of a setback. But I mean, we're feeling good. Everybody's ready to move in the direction of getting rid of these restrictions, but we're just doing it very cautiously. But nothing's changing at K-State for the rest of this semester. So.
This is Robin Cole, and it's been interesting both in looking at this from the perspective of an employer, as well as looking at this from the perspective of a mental health care service provider. And as an employer, part of what I'm seeing is something that's already been identified, which is just kind of mixed feelings among staff about the speed at which change is happening. I'm already fielding requests from some staff. And remember, we serve a 10-county area, and so it's both a mixture of semi-urban, rural, frontier, densely populated, rural. And so I have staff saying, when are we going to quit wearing masks? You know, when are you going to stop requiring us to wear masks? You know, clients asking that question, as well as then other staff saying, please don't lift the mask mandates any sooner than's absolutely necessary. And so kind of working with differing points of view among staff about, you know, the pace at which change is happening. Another concern that staff have is depending on the pace at which change is happening, what are the likelihoods that the third-party payers will no longer authorize telehealth services in the way that they have during the pandemic? I did see that the U.S. Department of Health and Human Services sent a letter to all the governors across the United States saying that the thought is that the public health emergency will probably remain in place through the end of 2021, and that Health and Human Services will give 60 days notice to state governments of an intention to end the public health emergency. From the perspective of a healthcare or a mental health care provider, I'm glad to see that they're looking at the public health emergency being extended throughout the whole of the year, and hope that commercial insurance companies as well as state Medicaid plan, for example, will continue to honor the diverse ways in which people can access care, to include telephone, to include televideo, and to include face-to-face. You know, we are, and so that is sort of, you know, what I'm seeing both as an employer. I guess another point I would make from the perspective of an employer is that we are seeing some people who are wanting to work just remotely. They're wanting to just work from home. In the mental health setting, that's particularly challenging. We're still doing a lot of telehealth, but the community mental health system as a whole is seeing, especially master's level clinicians, choose to leave community mental health to go to work for mental health providers that deliver services only remotely, and where there's no requirement of boots on the ground or face-to-face services. So I think part of what we may see is a change in some of those dynamics related to how mental health care in general is delivered, both at the therapist level as well as the psychiatrist or advanced practice registered nurse level. The other thing that I would note is just that we are beginning to see some requests for services return. You know, at the beginning of the pandemic, especially when we were operating under the stay-at-home orders, we saw folks really retreat home and not reach out for services. At the same time that we saw requests for crisis services increase, well, we're starting to see a return of some of the requests for services to levels that we were accustomed to before the pandemic. Thank you.
What are you guys hearing about business confidence? What are you hearing from your, neighbors, coworkers? Kind of what are they thinking about, their comfort in re-engaging in either activities or, going into certain businesses, et cetera?
I can speak to that. I think most everybody is really excited. There is definitely a buzz in the air. There's something just different going on. I don't know if that was because we had such great weather the past couple of weeks, but there is definitely this shift. It's a noticeable shift, while still being fairly cautious in a lot of businesses. Just starting to look further down the road, you know, your quarterly sales and the things that you do in your retail operations. I know for us, we got our event coordinator hired, and we are looking at all of our outdoor events and how we're going to pull those off. And we're really excited about being able to bring those back and offer something to the community that we think, based on just anecdotally hearing from all of our businesses, we think that the community for the most part is ready to do the types of, you know, breast cancer run and Third Thursdays, which is held outdoors, and Taste of Downtown, which we think we can do pretty safely, considering we also have the platform. So there is real enthusiasm. There's cautious optimism. Everybody is really trying to plan for the next 30 days, the next 2 months, the next 6 months, over the year, while we're all understanding that it's possible that we may have to shift again. I think that's one of the things we did all learn during the pandemic, was how to do that. Overall, though, consumer confidence, we think, is definitely, toes are in the water. I think people are rolling up their pant legs a little bit, getting some sun on their legs, and starting to feel like things could go back to a certain level of normalcy.
So Bob, we didn't talk about it a lot, but I think there was simultaneously you had the change in restrictions and the change in the orders at Fort Riley. And I do think that we noticed that as well as part of that. And so there is, I think Gina's right. I think there's, I've said to the commissioners today, county commissioners, as part of our monthly presentation, you can see it. We don't have the numbers yet, but you can see there seems to be momentum. We're hearing from some of our members that business is up. And I think the general consensus is, if we can sort of keep with what we have right now, that and not risk that I think that at least till the end of the school year, that generally people are interested in that. So yeah, I think Gina's right. I think the military orders had a lot to do with that as well, and hopefully we can sustain it and not see a big shift in consumer confidence that might come with any significant change in orders.
Steve,
I think one of the indicators will be, I think, this weekend with St. Patrick's Day parades and other gatherings. So we'll see how the community wants to turn out or not for some of these activities. So I think what Commissioner Ford said is, I was out and about too last Friday night seeing things, and I was impressed with how many people at restaurants and different things, even lines out the door when the full capacity was available. So, and of course, Gina, the downtown platforms are very nice to see how active they are.
Yes, Steve, any other comments or context from the base that you think might be helpful?
I did want to point out that on February 26th, so near the time that Riley County updated your general order, we did as well. And bottom line is, we removed many of the restrictions and control measures just based on the positive trends that we were seeing. We continue to evaluate that each week. In fact, at 4 o'clock is the next of those weekly meetings. I don't anticipate any further updates this week necessarily, but just a real quick summary of what we did on February 26th. And I know both sides of the community, Geary County, Riley County, are seeing the results of this. The curfew was rescinded. The ability to frequent restaurants and bars, to include dine-in, was reopened for 5 a.m. to 9 p.m. on a daily basis. We ask that our service members wear masks. That is a DOD requirement across the entire Department of Defense on all property owned by federal entities. Mask wear is required at all times, except for, as right now, I'm alone in an office with the door closed. So that is the lone exception for face mask wear. And so I would just ask our business community to help enforce that per your requirements. And then also, just if you recognize a service member, you should see them in masks unless they're actively eating or drinking. We opened up the ability to patronize off-post gyms, and on-post we increased in-home visitor limits and barracks room visitor limits. Not of huge consequence unless you're a service member. The travel radius of 150 miles was rescinded as well. Like I said, we continue to evaluate each week and just make sure our policies remain effective. Any questions for Fort Riley?
Hey, Steve, I don't have a question, but I just wanted to let you know that we have really missed our military families, and we're so glad to have them back downtown. And if you want to share that, pass that along. It's been Jason's right. It was a noticeable difference when you were not in the community dining in, and now it's a noticeable difference that you've lifted that and they can come back. So we're glad to see our families back.
I definitely will pass that along. Thank you.
Absolutely.
Hey, Kara, anything from Wamego that you might share?
Well, our city commission did extend the mask ordinance through April 10th. They did approve the Tulip Festival, which is really good news. So we are planning for that, of course, with some added, what I call COVID style activities. But, we usually have two craft tents, and so we're adding a third craft tent just so we can spread out those booths inside the tents. And then people will just be required to wear masks inside the tents. But otherwise, really, I think we're all feeling much, much better over here. Vaccines have started. St. Bernard Parish Hall hosted the first round of shots, and their next round of shots there are on Thursday the 18th. So about 800. Well, they've had two different rounds. I know that there was about 500 and some people that got vaccinated the first round, and then 800 and some vaccinated the second round. So I'm not sure how many are going to be on the 18th, but that's exciting. So a lot of our county is getting vaccinated. And I think that's all I have to report.
Hey, Cheryl.
I was just going to say, I was glad to hear the outreach to the populations that may not have access to Common Table or even be able, and just the efforts to reach those individuals with the vaccines. And what I'm hearing is I think we need to just keep pushing on the awareness and education for herd immunity, because I've heard mixed reviews. Even, so many people have been waiting so long for the vaccines, and then to hear individuals say, yeah, I'm not going to do that, it's just startling. but I'm hearing it now that they have the opportunity. And as Robin was saying, mental wellness, that's still something that has been triggered, and some individuals may be able to bounce back now that things are moving forward, but there are still individuals that are impacted by the loss of jobs or resources or family members, and they're still dealing with those challenges or the challenges that they may not have had pre-COVID. So that's something I think, just like Dennis was saying, employers are having to hire. We may need to look at the well-being of those employees and individuals in our community that are struggling with mental wellness.
Yeah, I do think the mass vaccination or large quantities, certainly that's a big help. I do think the county's done a great job of, and we've helped coordinate with them on a couple of these things of how do you reach out to a specific population like the homeless or the homebound. Actually, I think the folks in Riley County were doing that faster than maybe any other part of the state.
Absolutely.
And it's just, again, recognizing that we've got that need and then trying to figure out how to do it. But that's actually gone fairly well. I think that's been very encouraging.
I agree.
So I know the city folks, city commissioners, a number of them told me they always watch the tapes of this conversation. I guess thoughts or feedback for them, because they've had their first reading of a extension of masking. What would people on our call, what would be your thoughts? What would be your advice, encouragement for our city commissioners? And I think John's actually been very good at carrying that back to our county commissioners for us too. So.
I'll be the first.
Go first, Linda.
Throw an idea out there. Our preference at the university, and we've communicated this both to John's aware of it, the county commissioners and the city commissioners, is to keep the face mask ordinance in whatever fashion that needs to be between the city and the county, that we continue it through the school year. And for us, that ends May 16th. We're finished with our commencement. So, and again, that's driven by that time they'll have more people will be vaccinated. The numbers are trending in the right direction, but we just think we need a little more time. And of course, we will continue with the mask mandates on campus, but it's what happens when people go off campus. So our preference is to keep those ordinances in place until the school semester's out in May.
So I think we've been pretty open as well from a healthcare perspective. I know the physicians feel this way. We would certainly encourage the extension of the masking as well. And it's part of this is about COVID, obviously. We have actually seen massive benefit from a lot of other viral and respiratory type issues with kids in our community, older people in our community. We just, again, it'd be nice to get on through this entire kind of spring, big chunk of spring before we have a change, because that's certainly been very helpful. And again, I think I always remind people to the hand hygiene defeats good masking. So you've got to do good hand hygiene regardless. We've got to do that first, the hand hygiene or the masking and then social distancing. But hand hygiene is actually one of the biggest keys here. Other thoughts from task force member? I know Dennis Butler, you have to hop off here. Anything that you wanted to share today?
No, I didn't have anything specific. And I'm not going to give an opinion about extending the mask ordinance, because whatever's decided, of course, is what we'll do our best to enforce, and that's our obligation. For what it's worth, in terms of masking, everybody has their own experiences, and I'm not asking anybody else to out themselves, but I had flown late February of last year and actually returned to Manhattan on March 1st from a West Coast trip, and then everything locked down right after that. And I probably fly 5 or 6 times a year, and I didn't fly again until early December, I had to go to the East Coast on a business trip. And then in early February, I had to go to the Southwest on a personal trip. And I have to admit, I was very nervous about doing that. And it was after many of the airlines had dropped their middle seat empty policy. So I didn't know what to expect. But here's what I did. I typically wear one mask, but I wore two when I went to the airport. I also brought my own container to fill with water, and I brought my own snacks, so I didn't accept anything from any of the flight attendants. And I also was really surprised how full the flights were. Those two flights, or those two trips I took, were a total of 6 legs. 4 of them were full. One flight was out of KCI, one trip was out of Manhattan Regional. So I have to admit, I was a little nervous seeing all these people on an airplane next to me for up to 2 hours a leg. Second trip, I'd only had one vaccine. The first one in December, I had neither. But my point is, these flights were full, and I haven't received or read anything about outbreaks on the airlines, but I know what their requirements are in terms of masking and hygiene. And I finished those 6 legs without contracting anything. Still nervous, but I took extra precautions. So my point there is, I'm not going to give an opinion about a professional stance, but personally, I took extra precautions, and maybe there was nobody on those flights that had COVID, I don't know. But I ended up getting through it okay. So I just thought I would share that with all of you and anybody watching.
And I would probably just say something about authority and the fact that when entities that have authority are on different pages on issues, it makes it very difficult for those of us underneath their authority to exercise our authority. And so as somebody who has authority with Pawnee Mental Health, when CDC says one thing and KDHE says another thing, and generally they're in concert with each other, so there's no conflicts there. But when healthcare authorities say one thing, and state government authorities say another, and county government authorities have their voice, and city authorities have their voice, it makes it really challenging for a business authority to manage the dynamics, again, with employees and with people who they're serving. And so just a comment on the issue, and something that I think we all need to be aware of and think about.
And I would agree with that. I mean, if we just think about it down to the basics, as far as a household, we have school-age children and college young adults, and you're working in with an employer that has a requirement, and it's just less confusing to be consistent on the same page till we get through this, and that makes it much easier to have that consistency at home and keep everyone healthy, so that we can see family members, people can travel, and and be safe.
So I don't know if everybody's aware, this is the 1-year anniversary of the World Health Organization declaring COVID-19 as a pandemic. And we are 1 week away from when we admitted our first patient here. The patient, if I remember correctly, is actually from Potawatomi County, but that was our first actual positive patient at our hospital here in Manhattan. Yeah. Seems like a very, very long time ago. So we are scheduled again here in about another month. Are there other things, just topics that you would want us to have on agenda in April? Are there other things to either, we had a couple people kind of join us today, like Scott, to talk about the EOC. Are there other people like that from our communities that you would want us to ask just to come visit about something or explain something, just trying to think ahead for our next agenda. What's of interest, what's of use, what would be helpful to all of you?
On our end, we will be working on our recovery plan, the comprehensive economic development strategy. And so that includes a 7-county area, obviously Riley County, Potawatomi, Reed County are in that area. So we may end up deferring to you guys as the task force for recommendation or as a sounding board for some of the items that we're looking to put in that. And Cheryl, I know that you brought up mental health. That's one of the big ones that kind of goes unseen, but that's definitely something that we need to bring in there. And there's a lot of other components that as we get a little bit further along in that process, I just kind of wanted to float it out there for you guys that we'll probably chat with Dennis and Bob, and then hopefully Jason, and hopefully the whole task force a little bit as a sounding board for some ideas that we look to incorporate into that plan.
Other topic areas?
I think the only other thing would maybe be, I mean, just keeping track of our current trends, but just looking at, I mean, what really surprised us, what was going on in Brazil and in Europe right now, and maybe get some medical professional, some expertise that understands infectious diseases to kind of say, how do we keep track of this going forward so that we don't regress and that we don't fall backward in all the accomplishments that we've made. So, because right now that's it's just we've made so much progress, and I think from a mental standpoint and a physical standpoint, and just everybody's ready to move on, but we don't want to have this train hit us from the side. So it maybe is getting some more medical expertise on what do we think is really going on out there with these other variants, and what came to the United States, what was like a year ago, and just kind of get more of that surveillance of what is out there and what do we need to watch out for. Well, hopefully in another month we'll know where that federal funding is, and we can report on what we're doing with it. So we can talk about that.
Gina, you're on mute.
I wanted to add on to something that Linda just said, that would be very interesting to cover that sort of infectious disease topic. But I also appreciated it, the few times that we had Dr. Knopp to just kind of give us an overview of how our own community is doing, and the things that he knew that our medical community professionals were doing in the pandemic. So I would be interested to also hear from anybody local who can speak to our, what's going on maybe in our region also.
I can talk to the clinical task force leadership, the physicians, and see who we can schedule around for that day in April. If
Yeah,
they
that
can
would
either
be
schedule out a clinic, or if one of them happens to be off that day, if they'd be willing to jump on for 30 or 45 minutes. So. Other interests or gaps?
Yeah, so just from a personal perspective, not on the regional council, but summer like childcare options. I don't personally have children, but I have a lot of friends who have children, and as they're starting to get called back into work and they're not being school of any sort in the summer, of kind of what the childcare options look like during the summer, be it sports or anything like that, and how those might be impacted. I know some people have thrown out suggestions for certain things that I've seen, but I don't know if that's something that's going to be a pretty big issue once the summer does roll around. And if more people are vaccinated, people are going back to work, but maybe the childcare or whatever other extracurricular activities that happen during the summer haven't quite recouped as fast, or if they folded during this time and those aren't available anymore, if that's something we need to look into.
Actually, that's a good point, Marissa, because the city will be announcing what summer programs we're going to be running for youth sports or adult sports and how those will operate, plus day camps and stuff. And so a lot of that information will be flowing out actually within the next month. And so I think for our next meeting on April 8th, we should have a good lineup from the city side of things. I do know there's private camps and other things also underway, which I think is part of the excitement that people are looking forward to getting back into the summer routine. And then we'll even have from the city side, even about our pool information. So there'll be information out.
Jason, anything else before we close?
I don't have anything else. It's a good conversation.
So we'll see you guys back Thursday, April 8th.
And the Zoom link should be on the calendars.
And Dennis Marshall promised me a warmer, less windy day for that.
Yes.
So.
Hey, already better than yesterday, so you're welcome.
It's less windy anyway. I don't know about the warmer part, but it is less windy.
That's right. But yeah, we'll look to see you on April 8th, and I'll send out that stimulus data we sent out